Good afternoon, everyone, and welcome to another episode of Sunday Housecall. It's a pleasure and honor to be here. We have a very special guest today. My very good friend, Dr. Adam Rosenbluth, is with us, one of the finest cardiologists in the country. And for the record, he's also my doctor and has helped me stay healthy and stay in shape. So we have a lot of questions today, Adam. As you know, one of the latest news and breaking news is that the American Heart Association came up with changes in the guidelines of blood pressure. And since 2003, this is the first time that we're changing the numbers from 140/90 to 130/80. This is obviously a big change, and it really created a lot of discussions out there. People are concerned that now about half of the country are going to be diagnosed with blood pressure. So the big question is, why is this happening? And why now? And what is the impact of these changes in blood pressure and people out there?
David, that's a great question. I always tell my patients that comprehension breeds compliance. So I think the most important thing we're trying to do now is increase awareness among people about the presence of hypertension. Hypertension is called the silent killer because so many people don't even know that they have high blood pressure until they go in to see a doctor. So the first thing that happens when these guidelines change is people say, wow, there's something important here. Maybe I have high blood pressure. I should check it myself, go to the local supermarket, buy a blood pressure cuff at a pharmacy, and check my own blood pressure. When they see these guidelines, they're now instructed that the numbers are different. So as you indicated, the old guidelines said if your blood pressure was 140 as the top number or higher, or 90 or higher on the bottom, you had high blood pressure. So a lot of people didn't have high blood pressure. They were 138/85. However, it is recognized that people in that range of 130 to 140, over 80 to 89, can still have cardiovascular events, particularly if they have additional cardiovascular risk. They're a smoker, they're overweight, they have diabetes, a bad family history. These are all things that increase your risk. As a result, we have now decided that if your blood pressure is between 130 and 139 on the top, or 80 and 89 on the bottom, that you have stage 1 hypertension.
Before you get into the whole stage, I want to actually talk about different type of blood pressures. So we have a diagram that we made for you just to describe exactly what we were talking about. So based on this, as you can see, the normal is 120 or 130/80. And tell us about all this stage 1 and stage 2, and then finally hypertensive crisis.
Great. So the first thing I would say is that normal blood pressure is really below 120 over less than 80. Those are kind of the most easy numbers for everybody to believe. You run into an area of what's called elevated blood pressure if you're between 120 and 129 on the top, or above 80 on the bottom. Once you get into that 130 to 139 on the top, or 80 to 89 on the bottom, you're in the stage 1. And that's an important point because even though you may not require blood pressure medication, for example, with this new guideline, they are now saying that about 3 times as many men under the age of 45 and 2 times the number of women under the age of 45 will have a diagnosis of high blood pressure. But they won't require medication because they're only at stage 1.
So this is the biggest concern that I had when I read this, because the guidelines are the guidelines. We have guidelines for PSA screening,
Sure.
And it changes all the time. And to some extent, over the last 2 decades, we all become a little skeptical about these guidelines because they may change them in the future. The big concern is, are we going to overtreat and overdiagnose, or is this really a way to prevent them from getting to that cardiovascular and stroke zone?
David, you're so intelligent with that last comment. That's exactly what the issue is. We want to increase awareness at this point. I think people in general don't like to take medication. And honestly, as a doctor, I think it's wonderful when you can get people to change their lifestyle and improve their health naturally. So by changing the numbers, we are increasing awareness. So traditionally, somebody said, oh, my blood pressure is less than 140 on the top, less than 90 on the bottom. I can go out and eat whatever I want and do whatever I want and not exercise because I don't have to worry about it. Now we're saying, wait a second. If your blood pressure is above 130 on the top or above 80 on the bottom, You need to do something about it. You need to exercise. You need to lose weight. You need to quit smoking. If you're a diabetic or on the way to becoming a diabetic, you need to get your diabetes under better control.
Cut alcohol.
Cut alcohol. You know, we talk about that all the time. We say that 1 to 2 drinks a day for a man may be protective in terms of cardiovascular disease, but you have to balance that with the chance that they could raise their blood pressure with it. 1 drink or less for a woman a day could be protective of cardiovascular disease, but could also increase their blood pressure. So you're right. If you have high blood pressure, drop the alcohol. But let's talk about salt for a second. Salt tastes good. Everybody likes salt, but it really isn't good for us. There are examples of diets, such as the DASH diet. These are examples that you can easily look up online that try and minimize the amount of added salt in your diet. All food has natural sodium in it. But nowadays, for taste, particularly if you go out to dinner, restaurants will salt food. Why does a steak taste better when you eat it at a restaurant than when you cook it at home? At least in my house. The reason is that you add salt to it. In the kitchen, they add a lot of salt. That raises your blood pressure. If you can reduce the amount of salt that you eat per day to, let's say, less than about 2,500 grams, that's 2,500 milligrams, 2.5 grams. That's a pretty easy number to hit. Why? Because everything you buy nowadays has the salt content. So just look at the salt content. If you're looking for a snack in the middle of the day, you're hungry, and you pick up a bag of potato chips, and you see on the side that it's got 1,000 milligrams of salt, you've eaten half the salt just with that snack in one day.
Well, what's interesting is that a lot of people don't realize how much salt is in their food.
Huge.
So in all the canned food, in fast food, French fries, there's so much salt that's already added. And when I see people in the restaurant, sometimes they add even more. It's like blows your mind away, because that's perfectly fine. Now, I'm a huge fan of Mediterranean diet. I've spoken about Mediterranean diet. That's part of the world I came from. All the red wine and chocolate and nuts and salmon and healthy food. And then there's fat is actually good for you. You have avocado, so healthy fat is part of it. But I think this DASH diet, by the way, DASH stands for Dietary Approach to Stop High Blood Pressure, Hypertension. And that's when you cut down the amount of sodium from 3,500 milligram to 2,300 milligram, which is advised.